This is week 10 of the Leukopak Lady. I'm continuing the discussion on regulatory issues that impact starting materials for allogeneic cell therapy. Today, I focus on the role of accreditation in GMP compliance. But spoiler alert, there is none, at least not a required role. There are two recognized accrediting bodies for cell and gene therapy: the Foundation for the Accreditation of Cell Therapy, or FACT, and the Association for the Advancement of Blood and Biotherapies, or AABB. Both organizations put out comprehensive evidence-based standards, which are guidelines designed to ensure high-quality collection, laboratory, and patient care practices in the cell and gene therapy field. FACT standards are published in coordination with the Joint Accreditation Committee of ISCT and EMBT, or JC, based in Europe. AABB puts out the standards for cell therapy services. The scope of these standards cover hematopoietic stem cells, immune effector cells, genetically modified cells, bone marrow, peripheral blood, cord blood, and other tissue sources. The standards apply to donor eligibility, collection, processing, storage, transportation, administration, and clinical application of cell-based therapies. They are designed to promote quality and safety, ensure compliance with international best practices, and foster continuous improvement. And I'm not here to promote one type of accreditation, but there could be reasons certain organizations may choose one over the other. Very simply put, FACT JC standards are more clinically oriented, which may be better for organizations that administer cell therapies, participate in patient care, and are focused on clinical outcomes. AABB accreditation may be better for facilities focused on collection and processing services because it's more flexible and modular, making it more direct for those organizations that do not participate in patient care directly. Both accrediting bodies are widely accepted in industry and commercial manufacturing settings, but FACT may be more common in clinical settings. Becoming accredited is a choice made by each organization, although making that choice opens doors for more opportunities than for those that are not accredited. Becoming accredited takes extensive time and effort to match policies, procedures, and practices with the most up-to-date version of the standards put out by FACT or AABB. Organizations must have a robust quality system, keep relevant records for staff training, equipment verifications, process validations, and other controls, which take time to put in place. It may take 1 to 2 years to be ready for inspection and gain accreditation. Nowhere in GTP or GMP requirements does it state that a facility must be accredited by FACT or AABB as part of compliance. However, when it comes to cellular starting materials, developers are looking more and more towards accreditation as a sign that a collection center is likely to meet their regulatory needs when it is time to use GMP-compliant materials. If a facility is accredited, it minimizes the risk to developers. It reduces some of the work to qualify a collection or processing site, and it improves documentation for IND filing. And because of that, developers are more likely to use accreditation standards to develop their IND requirements for the collection and processing site in the first place. So, accreditation is really creating standardization across the cell therapy field. And so while accreditation is not required for regulatory compliance, it does play a major role in regulatory confidence among developers of allogeneic cell therapies. And collectors would be strongly advised to work towards accreditation as a major pillar of their commercial strategy. On the next episode, I'll talk more about site qualification for Leukopak providers.